The treatment choices ultimately come from the patient, him or herself, with input from us, but we're working together. And so what I think is important for new patients to understand is that it's really a conversation and a journey together. The way I view my relationship with patients and their families, I think is best explained by a football analogy. You have the coach, you have the quarterback, and you have the team. And for me, the patient is the quarterback. Ultimately, the patient is the one making the play, throwing the ball. For me, I'm the coach. I'm the one who hears from the offensive coordinators, the neurosurgeons, the radiation oncologists. I think about the panoply of cancer treatments and all of the various options we can do to aggressively fight this disease. But at the same time, I'm listening to defensive coordinators, or at least thinking about how do we ensure that this patient has the best possible quality of life. We don't want our treatments to result in Pyrrhic victories where we've been aggressive, but the patient is suffering. So really, it's trying to take in all of that information. How do we aggressively treat the patient, but at the same time, treat the patient like they're our own family? We want our patients to have the best possible quality of life. Ultimately, as the coach, I give the quarterback this information. I give the patient treatment options, standard of care, various clinical trial options, and then I speak to the patient and tell him or her why I think potential options are the best for what he or she is facing now. And then ultimately, it's the team that activates the play. Once the patient decides, we have an amazing team of players from nurses, nurse practitioners, fellows, research coordinators, therapists, social workers, dietitians, and all of us work together to ensure success from the patient's plan. And of course, we're looking for touchdowns, but we also understand this is a long journey together, and these plays are long, and we're going to work through this together. I think it's important for patients, my patients, to know that I also have a laboratory that is primarily focused on the exact diseases that they come to see me for in the clinic. So I really value the patient perspective, and it brings a lot of new ideas to our research. At the same time, it brings up the clinical challenges we see in our patients. And in the laboratory, we're constantly focused on making things better for our patients. What I'm most excited about our research is really comes from a number of different collaborative projects we have with scientists here at Washington University as well as nationally. And those advances have to do with understanding why specific cancer cells may become resistant to the therapies we're using. If we can solve this puzzle, we can make a major breakthrough in preventing recurrence of brain tumors. And in doing so, we can really make an impact and lasting change on the quality of our patients' lives. What I'd like my patients to know is I'm focused on their care both in the clinic and in the laboratory.